the chairman to the podium to please present his remarks. Mr. Chairman.
Hello, how are you? Good. Members of the Presidential Task Force, distinguished ladies and gentlemen of the press, let me further apologize for the delayed national briefing, but just to assure you that we've been engaged in a series of meetings, all in an attempt to frame further course of action that this committee has to take in the coming days and weeks. In spite of that, I welcome you all to the national briefing by the Presidential Task Force on COVID-19 for Monday, 17th August 2020. And to say Nigeria is gradually inching towards the 50,000 mark of confirmed cases of COVID-19, with the total number of confirmed cases standing at 49,098 as at yesterday, 16th August 2020. The Presidential Task Force has continued to observe the noticeable decline in fatalities, high discharge rates, and consistent under 500 daily cases for the past 4 weeks, in spite of the huge jump in our testing capacity and the increase in the number daily tested conducted. The Presidential Task Force wishes to strongly remind all Nigerians that we have not attained the desired level that would enable us to make conclusive statements on the rate of infection in the country. We must therefore continue to do that which gives us record improvements and desist from actions capable of undermining our successes. The whole had its highest daily increase of 294,237 confirmed cases yesterday, bringing the total to 22.4 million, with a cumulative death of 771,000. These statistics are daily reminders that humanity is still endangered by this virus. We are also reminded that countries that appear to have overcome the pandemic are actually being forced to reintroduce even stricter containment measures. As a country, Nigeria should not and would not lower its guard. And as a people, we should also improve our compliance to the various protocols at all levels. Today, the senior secondary school certificate examinations commenced all over the country, like in other West African states, and the Presidential Task Force is happy to note the high level of compliance with the protocols for the reopening of exit classes. It is in this light that we appreciate the call by the National Association of Nigerian Students, NANS, institutions. As a listening government, we wish to state that education is topmost on the priority list, and the reopening of our institutions remain critical within set safety parameters. I want to use this opportunity to appreciate the subnational levels of government for their efforts at advancing the risk communication and community engagement strategy. The Presidential Chinese company. May his soul rest in peace. Before I close these remarks, it is important that I plead with Nigerians to remain focused on our individual and collective fight to win this fight against COVID-19 and not engage in destructive information dissemination. One of such is the viral trend on the social media about collection of sums of money for a COVID-19 negative result. For the benefit of all Nigerians, and has been explained previously by the DG, Nigerian Center for Disease Control, samples are only collected at designated centers and not at the airports. It is therefore inconceivable that test results would be given at the airports where only passports of returnees are collected. It is disturbing to realize that while a good number of Nigerians are sharing their experiences with the coronavirus and encouraging others to take responsibility, some very few Nigerians are bent on spreading misleading information. Let us remember, therefore, that this war can only be won when we individually and collectively take responsibility so that we can return to a life devoid of this pandemic. Just comply with the measures put in place. Wear your mask properly. Wash your hands regularly. Stay away from crowds. Maintain social distance and join the campaign to fight COVID-19. I now have the honor to call on the Honorable Minister of Health, the representative of the DG, Nigerian Center for Disease Control, and the National Coordinator to provide us with technical updates. I thank you so much for your attention. And once again, our sincere apologies for starting this briefing late. And have a very pleasant and good evening. Thank you.
The chairman of PTF, honorable members of PTF, honorable ministers and national coordinator, permanent secretary, directors, good afternoon, good evening, as it is now. As of the 17th of August, 2020, Nigeria has recorded 49,068 COVID-19 cases from 352,625 samples tested so far, with 36,497 persons successfully treated and discharged. We have sadly had 975 fatalities and a case fatality rate that is still around 2%. We continue to strive to lower the case fatality rate, aiming for something less than 1%, because we believe more lives can be saved from COVID-19 with the knowledge and system strengthening we have achieved over the past 6 months, even though I hasten to add that we do not yet know everything about COVID-19. But what we are sure of so far is that a strong response to COVID-19 is a collaborative effort between citizens and government for the benefit of all. While government provides direction, guidance, and the resources, citizens are to take ownership of this response. The apparently fewer COVID positive cases of the past few days should give us no reason to start rejoicing yet or to lower our guard. As we expand and include small towns and rural areas in our testing scope, a more accurate picture of our COVID-19 status will emerge. There is good reason to prepare for COVID invasion in rural areas with more testing, first aid, ambulance services, and the commensurate isolation and treatment centers. However, we note with concern the development in many overseas countries, the development of sharp upsurge in COVID-19 cases after they lifted or relaxed restrictions on air travel, commerce, and especially social activities. We know that some countries had to quickly restore lockdown or quickly limit movement of citizens or to postpone elections in order to deal with COVID-19 spike. In one country, thousands of members of a congregation of a religious group had to be put in quarantine, having tested positive. These are significant lessons for us as we ourselves prepare to reopen our economy and as we consider options for resuming flights and travel operations or opening schools and land borders. Unless we utilize lessons learned and also learn from others to define and set measured precautionary steps to mitigate the risks, the danger of falling into the same negative balance in our own COVID-19 strategy and losing the gains made so far, that danger is real. The impact of lockdown on livelihoods and socioeconomic activities is well known and is serious, and it is what we wish to avoid. The other side of this coin is the question of what we need to do to mitigate the challenge, to mitigate the effects and take up the challenge of keeping control of COVID-19 as we reopen. This is a shared responsibility of government and people and an assignment for the entire country. It has been repeatedly stressed that the easiest, cheapest, well-proven options are still the simple non-pharmaceutical interventions like wearing your mask, avoiding crowds, frequently washing your hands, etc., etc. This is a list that citizens can contribute by adhering to these measures and urging their neighbors to adhere so that we together can stand the better chance of limiting the negative consequences on the economy of easing and opening our borders. The continuity of health routine services, capacity building of health workers, and their protection are paramount to the Federal Ministry of Health, and it is therefore a good opportunity to now urge all our health workers to continue to focus on their assignments from traveler screening, surveillance, sample collection, laboratory analysis, to hospital and other forms of care. It is critical to maintain strict infection prevention and control measures at all times, to help educate the citizenry, to support uptake of testing and reporting early for treatment when the test is positive. We cannot afford to have many of our health workers going to quarantine. The national health system is responding well enough so far to the COVID-19 challenge. Collaboration with states and local governments remains a cornerstone of a successful strategy. The federal government is doing the needful to support funding to states, from disbursement of basic healthcare provision to funding from REDISE program and PTF and other sources which are under preparation. I paid an inspection visit to the Emergency Operations Center of the National Center for Disease Control for an assessment of our COVID-19 response efforts in the pillars under their purview, and I noted the strong strategies to improve the core Connect Center, the surveillance, case finding and sample collection and testing, and in particular, the issue of turnaround time for testing, which were all discussed. NCDC is also making good efforts to ensure that all laboratories in our network have also a turnaround time under 24 hours. Nigeria continues to monitor new opportunities and developments in other countries, including new technology like saliva-based COVID-19 test that is under development. The Federal Ministry of Health is also working with agencies and partnering with state governments to serve rural areas by making sure that we maintain routine services and immunization. And we're also taking COVID-19 response to LGAs with sample collection, holding rooms, oxygen treatment centers, etc. State epidemiologists are requested to kindly speed up processing of test results and facilitate treatment and isolation of positives to address the gaps in the value chain. We have repeatedly also urged that all vulnerable persons with pre-existing conditions need to be protected. I also visited the This Day Dome Treatment Center, where over 120 patients have received treatment, and I note that the center is functioning very smoothly. I have directed that it be upgraded to a comprehensive level 3 center with ventilators and other critical machines for a functional intensive care unit and dialysis facilities. I thank you all for listening.
Good evening, Chairman, sir. Good evening, Honorable Ministers. Good evening, Director Generals. Good evening, ladies and gentlemen of the press. And my focus today is on how to get tested. Now, this afternoon, we announced the 64th lab activated for COVID testing in the country, and that's in Zamfara State. We've gone from 5 labs in March to 64 labs 6 months into the response. To date, we have activated at least 1 lab in 33 states, and out of the 36 plus 1, that's FCT. Ultimately, we aim to make testing process seamless as possible for Nigerians, and that means we want to get it to all the 36 plus 1 FCT states. At the initial stage of response, the known symptoms for COVID were limited to just a few, such as dry cough, fatigue, difficulty in breathing, fever. But as knowledge of the disease has evolved, we also know that there are some other symptoms that we need to look for, and that includes diarrhea, loss of taste or smell, aches, pains, sore throat, and every other symptoms that are very unusual for us. Persons infected with the virus can either be symptomatic, pre-symptomatic, or asymptomatic. The symptomatic cases show symptoms, and that's what most of us are looking for. The disease is usually mild, moderate, or severe, and can transmit the virus to others. The pre-symptomatic cases are persons that are infected and can still transmit, but do not have the symptom yet, but later show the symptoms. So at that stage when they are not showing the symptoms, they can transmit the virus. And then the asymptomatic cases are those that do not develop symptoms at all, but they can transmit. And we have a larger number of people that are symptomatic amongst us. However, we have very vulnerable groups that develop severe complications, and they require intensive care if infected. These are mainly people with weakened immune system and people above 60 years with existing health conditions. As I mentioned at our last meeting, our strategy is to detect, isolate, and manage cases so that they can recover fast. And for us to achieve this, we also need all Nigerians to take responsibility and play their part. And that means if you develop any of these symptoms, or even mild symptom, weakness, tiredness, get tested, please. If you believe that you have been in contact with a confirmed case, or you suspect that you have been in contact with a confirmed case, and you do not have symptoms, get tested, please. It is very important that we do not self-medicate. While you may not develop symptoms immediately, you could unknowingly infect others, and gradually you might develop symptoms that will be severe and critical. So we urge that you do not self-medicate, please. To get tested, you need to simply visit the nearest sample collection center in your state. If you do not know where it is, you can get the state hotline, call the hotlines, or you could also look for the state hotlines at the NCDC website. That's covid19.ncdc.gov.ng. When you get tested, please provide accurate information. That is very key. Sometimes we say we do not get our test results because we do not even provide the necessary information. Some do not provide the right names. Some provide very wrong phone numbers. So there's no way of getting in touch with the person. So let's provide the necessary information so that you can benefit from the care. Yes, we know that results, we have issues with results, getting results. But we're working with the state. We have a platform that we want to use. It's still work in progress. We've piloted it in FCT. We're working with the FCT team to launch it. And once that is done, we will escalate to the other states. And before we escalate, we have to do a lot of processing. Talk to the state, talk to the laboratory. So there is a lot of process involved, but it's work in progress. We will definitely get there. Finally, I would like to ask Nigerians to please seek information in the right places. Official channels, we've had complaints of several people being praised to scams. And please let us note, the NCDC is not giving people money and will not send any message to people asking for money to be employed. We are currently investigating these scams. Of course, the culprits will be brought to book. Thank you.
The chairman of the PTF, honorable ministers, members of the PTF, gentlemen of the press, good evening. Well, interestingly, all three of us have been talking about the same issue. The Honorable Minister of Health, the representative of the NCDC, and myself. We're all talking about testing independently without having consulted each other. And I think this really shows the importance of testing in terms of managing the COVID response. So, as mentioned by the Honorable Minister, we're seeing a low level of positivity across the country, but it's important to understand, and we need to get that information out. It does not necessarily mean that the pandemic is waning or over. And this is a reflection of the number of tests we're doing, which still remains, even though we're doing 3,500 on average every day, but this is still insufficient, and it's not widespread. One of the main drivers for this is the poor demand that we have across the country. Our capacity, having opened 64 laboratories in the country, our capacity for testing is about 10,000 a day. But people are just not coming forward. There may be a number of reasons for this, of course. It includes stigma, it includes discrimination and disbelief, which continue to be key factors in not only our inaction, but also non-compliance to COVID-19 protocols. It's important to know that for every single case we get positive, we are missing a lot more. Not one, not two or three, but a lot more than that. So as a matter of urgency, we really need people to get tested in order to get a clear idea of COVID-19 transmission in the communities. Importantly, if people don't get tested, they risk endangering our older and vulnerable population who are at much higher risk. Our data suggests that the majority of people who get COVID in Nigeria are between the ages of 20 to 39. And these are the very group that will be running around either asymptomatic or having very mild infections, but still infectious and still able to transmit to others. And they are also the group that are least likely to comply with non-pharmaceutical interventions. So as a country, we need to understand that COVID-19 is still a significant threat to us, as well as the rest of the world. And more importantly, it's only by testing that we can get on top of the problem. Testing, as well as making sure that we follow those preventive measures. If we all test, if we all increase our testing capacity, if we are able to define where the problems are, the faster we'll be able to get on top of this pandemic and the amount of commodities over the last few weeks, and the US government for supplying 200 ventilators, as well as the maintenance and the training that comes with them. Finally, we are also grateful to the Aliko Dangote Foundation for providing financial support as well as ventilators for the CPAP BiPAP study that is being coordinated by NIMA. Thank you.
Gentlemen of the media, good afternoon to you all. Well, the good news. We are very glad today to announce that international flights will resume from the 29th of August 2020. It will start just like we did with the domestic. It will start with Lagos and Abuja.